Have you ever felt unexplained fatigue, dizziness, or strange changes in your body that you couldn't quite explain? Many people over 70 assume that certain symptoms are just a normal part of aging, but what if your body is actually sending you warning signs of a serious health issue? The truth is, most seniors don't realize that their body often gives them early clues that something is wrong. And if these signs are ignored, the consequences can be life-threatening. Some of these symptoms may seem harmless, but in reality, they could indicate that your organs, circulation, or nervous system are under serious strain. In this video, we'll go over 12 hidden warning signs that may suggest your health is at risk. If you notice any of these symptoms, don't wait. Getting help early could save your life. As we go through the list, pay attention to which signs you've noticed in yourself or a loved one. And before we dive in, make sure to hit the subscribe button so you never miss important health insights that can help you stay strong, independent, and healthy for years to come. Losing weight without trying might seem like a good thing, but sudden, unexplained weight loss is often a serious warning sign that something is wrong. Many seniors dismiss it as a natural part of aging, but in reality, it could indicate underlying health issues like thyroid problems, diabetes, digestive disorders, or even cancer. If you've lost more than 5% of your body weight in a short period without changing your diet or exercise routine, it's time to pay attention. One of the most common causes of unexplained weight loss is muscle wasting due to poor nutrition or chronic illness. As you age, your body requires more protein and essential nutrients to maintain muscle mass and prevent frailty. If you're not eating enough or absorbing nutrients properly, your body will start breaking down muscle tissue, making you weaker, less mobile, and more prone to falls. Another major concern is metabolic changes caused by conditions like diabetes or hyperthyroidism. These diseases can cause your body to burn through energy too quickly, leading to unintended weight loss, fatigue, and even heart problems. If you've noticed weight loss along with symptoms like increased thirst, excessive hunger, or frequent urination, it's important to get checked by a doctor as soon as possible. Digestive issues can also play a role. Conditions like ulcers, inflammatory bowel disease, and even undiagnosed cancers can affect how your body processes food. If you've noticed that you're losing weight while also experiencing bloating, changes in appetite, or frequent stomach discomfort, it's essential to get evaluated. The key takeaway? Unexplained weight loss is never something to ignore. Even if you feel fine otherwise, a sudden drop in weight could be your body's way of telling you that something isn't right. Early detection of underlying health conditions can make a huge difference in treatment and long-term health. If you're enjoying this video and want more insights on how to protect your health and stay strong as you age, don't forget to like this video and hit the subscribe button. It really helps support the channel, and you'll never miss our future tips on staying active, independent, and healthy for years to come. Feeling constantly tired, no matter how much rest you get, is not just a normal part of aging. It could be a sign that something is wrong inside your body. Many seniors ignore persistent fatigue, assuming it's just due to getting older. But chronic exhaustion is often a symptom of an underlying health issue that needs attention. One of the most common causes of ongoing fatigue is anemia, or low red blood cell levels. When your body doesn't have enough red blood cells to carry oxygen efficiently, your muscles, brain, and organs struggle to function properly, leaving you feeling drained and weak. Anemia can be caused by a lack of iron, vitamin B12, or hidden internal bleeding. So if you've been feeling lightheaded, short of breath, or weaker than usual, it's time to get checked. Another major culprit behind fatigue is thyroid dysfunction. The thyroid gland controls metabolism, energy levels, and even brain function. If your thyroid is underactive, hypothyroidism, you may feel constantly exhausted, cold, or even experience unexplained weight gain. This condition is more common in seniors and is often overlooked, but a simple blood test can determine if your thyroid is functioning properly. Chronic fatigue can also be a warning sign of heart disease. If your heart isn't pumping blood efficiently, your muscles and organs won't get enough oxygen, making you feel sluggish and weak. If your fatigue is paired with shortness of breath, chest discomfort, or swelling in the legs, don't ignore it. It could be a sign that your heart is struggling. Other conditions that cause persistent fatigue include diabetes, sleep apnea, and even hidden infections in the body. If your tiredness comes with increased thirst, frequent urination, or brain fog, it could indicate that your blood sugar levels are too high or too low. And if you wake up feeling just as tired as when you went to bed, a sleep disorder like sleep apnea may be depriving your brain of oxygen at night. Fatigue isn't something to brush off. Your body is trying to tell you something. If you've been feeling unusually drained for weeks or months without explanation, don't ignore it. A medical checkup can help uncover the cause and get you the right treatment before it leads to more serious health problems. Have you ever struggled with unexplained fatigue? Let me know in the comments. Struggling to catch your breath, even during simple activities like walking up the stairs or getting out of a chair, is not just a sign of aging. It could be a serious warning from your body. Many seniors assume that feeling winded more often is just a normal part of getting older. But in reality, shortness of breath can indicate underlying health problems that require immediate attention. One of the most common causes is heart disease. When your heart isn't pumping blood efficiently, your muscles and organs don't get enough oxygen, making even light activity feel exhausting. If you notice tightness in your chest, swelling in your legs, or dizziness along with shortness of breath, it could be a sign of heart failure, high blood pressure, or blocked arteries. These conditions can develop slowly, so don't ignore the early warning signs. Another major cause is lung disease. Conditions like chronic obstructive pulmonary disease, COPD, asthma, or even undiagnosed lung infections can make breathing feel more difficult over time. If your shortness of breath is accompanied by a chronic cough, wheezing, or frequent respiratory infections, it's essential to get checked by a doctor. Shortness of breath can also be a sign of anemia. If your body doesn't have enough red blood cells to transport oxygen, your muscles and brain will struggle to function properly, leaving you feeling lightheaded and weak. Anemia is especially common in older adults and can often be treated with dietary changes or supplements. Another dangerous possibility is a blood clot in the lungs, pulmonary embolism. This can happen after long periods of sitting, recent surgery, or if you have an underlying clotting disorder. If your shortness of breath comes on suddenly, is severe, or is paired with sharp chest pain, seek medical help immediately. Regardless of the cause, shortness of breath should never be ignored. If you find yourself getting winded more often, even during routine activities, it's a sign that your body needs help. The sooner you get evaluated, the better your chances of preventing serious complications. If you're enjoying this video and want to learn more about how to protect your health as you age, don't forget to like this video and hit the subscribe button. It really helps support the channel, and you'll never miss our future tips on staying strong, independent, and healthy for years to come. Feeling dizzy or experiencing frequent balance problems may seem like a minor inconvenience, but it could be your body's way of signaling a serious health issue. Many people assume that occasional dizziness is just a part of aging, but when it happens regularly, it can indicate underlying conditions that should not be ignored. One of the most common causes of dizziness is poor circulation. If your heart isn't pumping blood efficiently, your brain may not be getting enough oxygen, leading to lightheadedness and instability. This can be a sign of heart disease, low blood pressure, or even dehydration. If your dizziness happens when you stand up too quickly or after meals, it could be linked to blood pressure fluctuations that need medical attention. Another major cause is inner ear problems. Your inner ear is responsible for balance and coordination, so conditions like vertigo, infections, or fluid buildup can make you feel unsteady. If your dizziness is accompanied by ringing in the ears, nausea, or sudden spinning sensations, it may be a sign of an inner ear disorder that needs treatment. Dizziness can also be a warning sign of neurological conditions like Parkinson's disease, mini strokes, TIAs, or even early signs of dementia. If you experience unexplained balance issues along with memory problems, confusion, or difficulty walking, it's crucial to speak with a doctor. These symptoms may be early indicators of a more serious neurological condition. Low blood sugar is another possible culprit. If you feel dizzy, shaky, or weak, especially after long periods without eating, it could mean that your blood sugar levels are too low. This is especially important to monitor if you have diabetes or prediabetes. One of the biggest risks of frequent dizziness is an increased chance of falling, which can lead to fractures and serious injuries. If you've been feeling unsteady, take precautions to make your home safer. Remove tripping hazards, install grab bars, and always stand up slowly. But most importantly, get checked by a doctor to find the root cause before it leads to a dangerous fall. Dizziness isn't something to brush off. It's your body's way of telling you that something isn't right. If you've been experiencing balance issues or lightheadedness, don't ignore it. Getting the right treatment could prevent a serious accident or uncover a hidden health problem before it worsens. Have you ever struggled with dizziness or balance problems? Let me know in the comments. Swollen legs or ankles might seem like a minor inconvenience, but they can be a serious warning sign that something is wrong inside your body. Many people assume that swelling is just due to aging or standing for too long, but persistent swelling can indicate problems with circulation, kidney function, or even heart failure. If you've noticed your feet, ankles, or legs becoming puffy or feeling unusually heavy, it's time to pay attention to what your body is trying to tell you. One of the most common causes of swelling in the lower body is poor circulation. When your heart struggles to pump blood efficiently, fluid can build up in the legs, ankles, and feet, leading to swelling known as edema. This is a classic sign of congestive heart failure, a condition where the heart isn't able to circulate blood effectively. If the swelling worsens as the day goes on, feels tight or painful, or is accompanied by shortness of breath or fatigue, it could be a serious heart issue that requires immediate medical attention. Swollen legs and ankles can also be a sign of kidney problems. Your kidneys are responsible for removing excess fluid and waste from your body, and when they're not functioning properly, fluid retention can cause noticeable swelling. If you've been experiencing swelling along with fatigue, changes in urination, or puffiness around the eyes, it could be an early indicator of kidney disease. Another cause of swelling is deep vein thrombosis, DVT, a dangerous blood clot that forms in the deep veins of your legs. If you notice swelling in just one leg, along with redness, warmth, or tenderness, you should seek medical help immediately, as DVT can be life-threatening if the clot travels to the lungs. For some people, swelling can be caused by varicose veins, sitting for too long, or certain medications like blood pressure drugs or steroids. However, if the swelling is persistent, worsening, or accompanied by other symptoms like pain, breathlessness, or skin discoloration, it's important to get it checked out. To reduce swelling, try elevating your legs above heart level for short periods, staying hydrated, reducing salt intake, and engaging in light movement like walking or stretching. Compression socks may also help improve circulation, but it's essential to find out the underlying cause rather than just treating the symptom. Swelling isn't just a cosmetic issue, it's your body's way of signaling that something may be wrong. If you've noticed persistent or unusual swelling, don't ignore it. Getting the right diagnosis early can prevent serious complications down the line. Difficulty swallowing, also known as dysphagia, might seem like a minor inconvenience, but it can be a serious warning sign of underlying health issues that should never be ignored. Many people assume that occasional trouble swallowing is just part of getting older, but if it happens frequently or gets worse over time, it could indicate a problem with your nervous system, muscles, or even your esophagus. One of the most common causes of difficulty swallowing is acid reflux or gastroesophageal reflux disease, GERD. Over time, stomach acid can damage the esophagus, causing inflammation and making it harder to swallow food comfortably. If you've been experiencing heartburn, a sour taste in your mouth, or a feeling of food getting stuck in your throat, your body may be warning you that your digestive system needs attention. Another serious cause of swallowing problems is neurological disorders like Parkinson's disease, stroke, or multiple sclerosis. These conditions can weaken the muscles that control swallowing, making it harder for food and liquids to pass through safely. If you've noticed slurred speech, muscle weakness, or coordination problems along with difficulty swallowing, you should seek medical advice as soon as possible. Dysphagia can also be a sign of esophageal cancer, a condition that often develops silently. If swallowing difficulty worsens over time, is accompanied by unexplained weight loss, pain in the chest or back, or a persistent cough, it's crucial to get checked by a doctor immediately. Early detection of esophageal cancer greatly improves treatment outcomes. Another hidden cause of difficulty swallowing is a condition called achalasia, where the esophagus loses its ability to push food down into the stomach. This can lead to a sensation of food sticking, frequent choking, or regurgitation. If you often feel like food is getting stuck and have to drink lots of water to help it go down, this could be a sign of a serious esophageal disorder that needs medical evaluation. If you're struggling with swallowing, start by making small dietary changes. Eating softer foods, chewing slowly, and drinking plenty of water with meals can help reduce discomfort. However, if the problem persists, don't ignore it. Swallowing difficulties can lead to choking, malnutrition, or even aspiration pneumonia, which can be life-threatening. Swallowing should be effortless. If you're frequently experiencing discomfort or struggling to eat, it's time to listen to your body and get checked by a professional. Catching the cause early can prevent more serious complications down the road. Have you ever had trouble swallowing? Let me know in the comments. A chronic cough that just won't go away might seem like a minor nuisance, but it can actually be a serious warning sign that something deeper is happening in your body. Many people dismiss a persistent cough as allergies, dry air, or just getting older. But if it lasts for weeks or months, it could indicate an underlying health problem that shouldn't be ignored. One of the most common causes of a chronic cough is chronic obstructive pulmonary disease, COPD, which includes conditions like emphysema and chronic bronchitis. If you have a lingering cough that's accompanied by shortness of breath, wheezing, or mucus production, it could mean that your lungs aren't functioning as well as they should be. COPD is progressive, but early intervention can help slow its effects and improve breathing. Another possible cause of a chronic cough is acid reflux or gastroesophageal reflux disease, GERD. Stomach acid can travel up into the esophagus and irritate the throat, leading to a dry, tickling cough that worsens at night or after meals. If you frequently experience heartburn, a sour taste in your mouth, or throat irritation along with your cough, your digestive system could be the culprit. Lung infections, even mild ones, can also cause a cough that lingers for weeks. Pneumonia, bronchitis, or even an undiagnosed lung infection could be irritating your airways. If your cough is accompanied by fever, fatigue, chest pain, or coughing up blood, it's crucial to seek medical attention immediately. A persistent cough can also be a symptom of lung cancer, especially if it changes over time or comes with unexplained weight loss, hoarseness, or chest discomfort. While it's not the most common cause, if you have a history of smoking or long-term exposure to environmental toxins, it's important to get screened. Early detection of lung cancer significantly improves treatment outcomes. Certain medications, particularly those used to treat high blood pressure, ACE inhibitors, can cause a chronic dry cough as a side effect. If you started a new medication and noticed a persistent tickling cough, talk to your doctor about adjusting your prescription. If you have a cough that lasts longer than 3 weeks, keeps you up at night, or is getting worse instead of better, it's time to take it seriously. Your body is trying to tell you something, and early intervention could prevent a serious condition from developing further. Have you ever experienced a chronic cough that wouldn't go away? Drop a comment below and share your experience. Dark urine or pale stools may not seem like a big deal, but they can be important warning signs that something is wrong with your liver, kidneys, or digestive system. Many people don't pay attention to changes in their urine or stool, but your body uses these signals to tell you when something isn't functioning properly. One of the most serious causes of dark urine is liver disease. When your liver isn't working properly, bilirubin, an important substance that helps break down waste, can build up in your body instead of being filtered out. This can lead to urine that looks dark, yellow, brown, or even tea-colored. If you also notice yellowing of your skin or eyes, jaundice, fatigue, or unexplained nausea, your liver may be in trouble and you should seek medical help immediately. Another possible cause of dark urine is dehydration. When you don't drink enough water, your urine becomes more concentrated, turning a deep yellow or amber color. If your dark urine is paired with dizziness, dry mouth, or low energy, it's a sign that you need to increase your fluid intake. However, if drinking more water doesn't lighten your urine, it may be time to check for an underlying health issue. Pale, clay-colored stools, on the other hand, can indicate a problem with your bile production, which helps your body digest fats. This could be a sign of a blocked bile duct, liver disease, or gallbladder problems. If your stools are persistently light-colored and greasy or foul-smelling, it could mean that your body isn't properly absorbing fats and essential nutrients. Certain medications, like some antibiotics and iron supplements, can temporarily change the color of your urine or stools. However, if you notice these changes and you're not on new medication, or if the changes persist, it's essential to get checked by a doctor. Blood in your urine or stools is always a reason to seek medical attention. Red or pink urine could indicate a urinary tract infection, UTI, kidney stones, or even bladder cancer. Black, tarry stools could be a sign of internal bleeding in your digestive tract. These symptoms should never be ignored. If you notice changes in your urine or stools that last for more than a few days, it's your body's way of telling you that something may be wrong. Catching liver, kidney, or digestive problems early can make all the difference in treatment and long-term health. Have you ever noticed unusual changes in your urine or stool? Let's discuss in the comments. Now, let's move on to another hidden warning sign that your body may be sending you. Forgetfulness or confusion may seem like a normal part of aging, but when these symptoms become more frequent, they could be a warning sign of something much more serious. Many people assume that occasional memory lapses are harmless, but if you find yourself forgetting names, misplacing items often, struggling to follow conversations, or feeling disoriented in familiar places, your brain might be trying to tell you that something isn't right. One of the biggest concerns with increased forgetfulness is the early stages of dementia or Alzheimer's disease. While occasional forgetfulness is normal, consistent memory problems, difficulty making decisions, or changes in personality can signal that the brain is undergoing changes that need medical attention. The earlier these issues are detected, the more effective lifestyle changes and treatments can be in slowing progression. Memory loss can also be a sign of circulatory issues affecting the brain. If your brain isn't getting enough oxygen due to high blood pressure, heart disease, or diabetes, it can lead to confusion, mental fog, and difficulty concentrating. If you've also noticed dizziness, numbness in the limbs, or vision changes, you may be at risk for a mini-stroke, TIA, which requires immediate medical attention. Another common but overlooked cause of forgetfulness is nutrient deficiencies. Low levels of vitamin B12, omega-3 fatty acids, and iron can cause brain fog, lack of focus, and even mood swings. Seniors are particularly at risk because nutrient absorption decreases with age. If you've been feeling mentally sluggish, a simple blood test can determine if you have any deficiencies that need to be corrected. Chronic stress and poor sleep quality can also weaken memory and cognitive function. If you're frequently waking up tired, experiencing anxiety, or dealing with ongoing stress, your brain may not be getting the rest and recovery it needs. Over time, high cortisol levels, the stress hormone, can damage brain cells and accelerate cognitive decline. Learning stress management techniques, improving sleep hygiene, and staying socially active can all help keep your brain sharp. One of the best ways to maintain brain health and prevent cognitive decline is to stay mentally active. Engaging in puzzles, reading, learning new skills, and socializing with others helps build new neural connections, keeping your brain strong and resilient. If you've been experiencing increasing forgetfulness, difficulty focusing, or unexplained mental fog, don't ignore it. Your brain is sending you a signal that it needs support. Early intervention can help protect memory, maintain independence, and improve overall quality of life. What do you do to keep your brain sharp? Share your favorite brain-boosting activities in the comments. Persistent indigestion or bloating might seem like a minor inconvenience, but it can actually be a sign of serious underlying health issues. Many people assume that occasional stomach discomfort is normal, But if you're frequently experiencing bloating, gas, acid reflux, or difficulty digesting food, your body may be trying to warn you that something isn't right. One of the most common causes of chronic indigestion is acid reflux or gastroesophageal reflux disease, GERD. If you often experience heartburn, a burning sensation in your chest, or a sour taste in your mouth after eating, it could mean that stomach acid is backing up into your esophagus. Over time, this can lead to inflammation, damage to the esophageal lining, and even increase the risk of esophageal cancer. If your symptoms occur several times a week or worsen when lying down, it's important to seek medical advice. Another possible cause of bloating and digestive discomfort is food intolerance or poor gut health. As we age, our digestive system produces fewer enzymes, making it harder to break down certain foods like dairy, gluten, or fatty meals. If you've noticed that you feel bloated, gassy, or sluggish after eating, your body may be struggling to process certain foods properly. Keeping a food diary to track which meals trigger your symptoms can help identify problem foods. Digestive issues can also be linked to gallbladder problems. If you experience bloating or pain in the upper right side of your abdomen, especially after eating fatty foods, your gallbladder may not be functioning properly. Gallstones or gallbladder disease can lead to severe discomfort and may require medical attention. Another serious but often overlooked cause of persistent bloating is colon cancer. If you've noticed chronic bloating, changes in bowel habits, such as constipation or diarrhea, unexplained weight loss, or blood in your stool, it's crucial to get screened. Colon cancer is one of the most preventable cancers when caught early, so don't ignore these warning signs. To support digestion and reduce bloating, focus on eating more fiber, drinking enough water, and incorporating probiotics into your diet. Cutting back on processed foods, artificial sweeteners, and carbonated drinks can also help reduce digestive discomfort. If you've been dealing with persistent indigestion or bloating that doesn't go away, it's time to listen to your body. Getting the right diagnosis can prevent small digestive issues from turning into major health problems. Have you ever struggled with bloating or digestive discomfort? Let's talk about it in the comments. Cold hands and feet might seem like a minor annoyance, but they can be an important warning sign that something isn't right with your circulation or nervous system. Many people assume that feeling cold is just part of aging, but if your hands and feet are frequently cold, numb, or discolored, your body may be trying to tell you something important. One of the most common causes of cold extremities is poor circulation. As you age, your blood vessels naturally become less flexible, making it harder for blood to flow efficiently to your hands and feet. If you often notice tingling, numbness, or a bluish tint to your fingers and toes, it could be a sign of peripheral artery disease, PAD, where plaque builds up in your arteries and restricts blood flow. PAD increases the risk of heart attacks and strokes, so it's important to address it early. Another potential cause is Raynaud's disease, a condition where small blood vessels in your extremities constrict excessively in response to cold temperatures or stress. This can cause your fingers or toes to turn white or blue and feel painfully cold or numb. While not life-threatening, severe cases of Raynaud's can lead to ulcers or tissue damage if left untreated. Cold hands and feet can also be a sign of thyroid dysfunction, especially hypothyroidism. The thyroid plays a key role in regulating metabolism and body temperature, and when it's underactive, you may feel cold all the time, experience fatigue, dry skin, or even unexplained weight gain. A simple blood test can determine if your thyroid is functioning properly. Diabetes can also affect circulation and nerve function in your extremities, leading to cold hands and feet, numbness, and tingling. Over time, high blood sugar levels can damage nerves and blood vessels, making it harder for your body to regulate temperature. If you have cold extremities along with frequent urination, increased thirst, or slow wound healing, you should get checked for diabetes. Other possible causes include low blood pressure, anemia, low iron levels, or side effects from medications like beta blockers. If your hands and feet feel cold, even in warm temperatures, or if you experience pain, cramping, or skin discoloration, don't ignore it. Your body may be signaling a deeper health issue. To improve circulation and keep your extremities warm, Try staying active, wearing warm socks and gloves, reducing caffeine intake, and massaging your hands and feet to stimulate blood flow. If cold extremities are persistent or accompanied by other symptoms, it's important to talk to a doctor to rule out any underlying conditions. Do you often experience cold hands and feet? Drop a comment below and let's discuss. Recognizing these warning signs early can make all the difference in protecting your health and preventing serious complications. Many people ignore these subtle changes in their body, thinking they're just a normal part of aging. But your body is always sending signals, and paying attention to them can save your life. The key to staying healthy as you age is listening to your body and taking action as soon as something feels off. If you've noticed sudden weight loss, chronic fatigue, difficulty breathing, dizziness, or persistent swelling, don't wait. Talk to a doctor and get checked. Catching these issues early can prevent them from turning into life-threatening conditions. It's also important to stay proactive with regular health checkups. Many serious conditions, like heart disease, diabetes, and cancer, develop slowly and silently. Routine, blood tests, screenings, and checkups can detect problems before symptoms even appear, giving you the best chance at early treatment and recovery. In addition to medical care, maintaining a healthy lifestyle can help you avoid many of these warning signs altogether. Eating a nutrient-rich diet, staying physically active, getting quality sleep, and managing stress can keep your body strong and functioning properly. Small daily habits, like staying hydrated, avoiding processed foods, and keeping your mind and body engaged, can significantly slow down the aging process and prevent chronic diseases. Most importantly, don't ignore your instincts. If something feels wrong, trust your body and take action. It's never too late to take control of your health, make better choices, and improve your quality of life.